All right, hi everybody. I'm Emily Hollich,
I'm Charmaine Cottrell.
And I'm Laura Hanlon.
and today we're going to present our poster for you guys on mental health awareness and the Mental Health Parity and Addiction Equity Act of 2008. So what this act did was basically it provided the same insurance coverage for mental health problems and mental illness as is provided for physical health care. Um, so basically, it enables people seeking care for mental health problems the ability to receive the same care, number of visits, co-pays, deductibles, things like that for their treatment as they already do for physical health problems. This applies to anybody who has health insurance, basically. Originally, the act was only applicable to those with group insurance, but with the passage of the Affordable Care Act in 2010, it was able to also be applied to individual health coverage. So basically, benefits delivered include coverage for mental health that parallels physical health. So doctor's visits, deductibles, copays, access to prescribed medication. Services are provided by doctors, therapists, psychiatrists, people like that, um, which is paid for by insurance companies. Insurance coverage is provided by employers, or if you get individual insurance, you pay for it. And then the services are financed wholly or subsidized by insurance companies.
Our targeted social problem discusses how the Mental Health Parity and Addiction Equity Act helps to provide health coverage that is affordable and reduces the stigma of obtaining mental health care. For example, we focus on military members returning home from deployment. While a majority of these soldiers do not return from duty having mental health issues, as you can see from the chart on the screen, 30% of the 730,000 soldiers are reported to suffer with PTSD or some other form of mental health illness. The importance of this act is to help target those who struggle with mental illness so that they can be seen and receive treatment to avoid and or gain control of their mental health challenges like depression, anxiety, substance abuse, and violent behavior. For many, stigmas like the belief that mental health is a Western culture sickness keeps them from seeking the help they need because they're afraid to acknowledge the need for help or fear what others may think. Current problems with the policies that exist today are that while mental health coverage is now more readily available, many therapies are not covered under insurance or may require pre-authorization in order to receive the proposed treatment needed.
The recommended change that we're proposing is that those diagnosed with mental health issues should be able to access care like any other medical diagnosis and be treated to referral services like any other medical specialty need. These issues would be addressed when patients have yearly physicals. An example of this would be an initial visit with a psychiatrist to gather information and any frequent subsequent visits with a psychologist and or psychiatrist to monitor and stabilize. The need for follow-up visits and frequency of visits should be reevaluated after a set period of time. These visits would be treated as specialists and billed accordingly. Our proposal would help dissolve the stigma of mental health and help to ensure that all those who are facing mental health challenges are being addressed and receiving adequate follow-up services until they present as stable, at which time visits could be less frequent until goals of stabilization and acceptable quality of life has been met. The change that this would create for social workers is that it would increase the need for them and mental health professionals as the evaluation and diagnosis of mental health issues increases. It could eventually level out as people get the help they need and become more stable and find acceptable ways to work through their challenges. Mental health and PTSD are serious illnesses that need all stereotypes and stigmas removed in order to ensure that everyone feels comfortable to seek the help they need. Yearly evaluation of mental health during physicals and insurance that appropriately helps cover any type of mental illness and frequency of care that is needed is determined to an individual's overall health.